Afternoon. Well, hello everyone, and welcome to our another session of YouTube OET live classes. We are thrilled to have you here today. And before we dive into our actual topic today, I would like to take a moment to introduce you something that is truly exciting. Yes,
No, can you please tell me what it is?
it's none other than our company, Charkos Global.
That's nice.
It gives me a pride to be a part of this company, which has been serving in the healthcare industry since 15 plus years, and which is leading in the education, training, and recruitment. Charkos Global is more than just a company, its vision turned into reality. Founded on the principles of innovation, excellence, and the commitment to pushing boundaries, Chapus has quickly become a leader in the healthcare, education, and training industry. Hope you agree with that.
Yes, I do. I definitely do. Because we are doing really well in both recruitment and training. It's really good to know that we have leaders from all around the globe joining us.
Yes. Well, I'm sure you know one thing. Our team of experts from all around the world, they work tirelessly every day to bring the solutions that are not only innovative but also tailored to meet the unique requirements of our clientele.
That's really nice to know. Yes. And this class today that we have been running, it is going to be about OET training, right?
Yes, and in particular, we will be looking into the writing module. In the previous session, we did look into the referral letters.
Yes, we did.
I hope you're going to teach us today some other different type of letter today in the class.
Well, yes, it would be a pleasure to teach everyone here. You see, the last time we did discuss in detail about all the four, paragraph requirements and everything. Today, before we get into it for our new viewers, we're just going to give you an overview of what OET is all about.
So, why wait then? Please stay tuned so that we can take you to the journey through what makes Charkos Global a truly special one.
Yes.
And don't forget, just reminder, we have a chat box here which you can use free to drop us a message. We'll be answering all your queries. Well, as you all know, Occupational English Test, which is known as OET, is an international language proficiency test, and this is specifically designed for healthcare professionals. And when we look at the assessment, what is being assessed in the examination, definitely the communication skills of the professionals who seek to work in English speaking countries will be tested.
Yes. So, whom does it cater to? It caters to nurses, and medicine, optometrics, podiatry, veterinary, dentistry, pharmacists, radiography, dietetics, occupational therapy, speech therapy, pathology, and physiotherapy.
I think there must be more than 12 professions.
Yes, there are.
Okay. When we look at the structure of the test, you will be analyzed, assessed on 4 different modules. And we do say, I think you will agree with me if I say that reading, writing, listening, speaking are the 4 pillars of any language.
Yes.
To consider that we are proficient in any language, I think we have to prove our excellence in these modules.
Definitely.
Yes. So each section of this or each module will be designed in such a way that would reflect the workplace scenario in your field. I think that makes OET comparatively easier for the healthcare professionals, isn't it?
Definitely, because there is always an iota of doubt in the candidate's mind. Do I take up IELTS,
Yes,
being a healthcare professional, or do I go with OET? So, this question always lingers, but, with OET, the advantage you have is each section is reflecting your actual workplace scenario. So that is an added advantage at any point in time.
Yes, and I think it's going to help a lot in writing and speaking, if I'm not wrong.
Definitely. And also you'll be very accustomed to listening to these medicines and about specialists and everything else. So I think this is best suited for a healthcare profession.
Yes, absolutely. So here are the details of the grades and the desired grade from most of the countries, developed countries, is you have to score a B grade, preferably in all modules. And in few countries, B grade is accepted in listening, speaking, and reading modules, and C plus grade is accepted in the writing module.
Correct. It is recognized all around the world by regulatory healthcare bodies and councils, hospitals, universities, and likewise. So the countries that recognize OET include, as you can see, Australia, New Zealand, United Kingdom, Ireland, Singapore, Philippines, and Dubai, Qatar, Spain, Canada, USA, Finland, Maldives, UAE, Ukraine, Sri Lanka, Malta, and Egypt.
I think most part of the world they're accepting now.
Yes, they have.
Well, you can register for the OET exam through the official OET website. And when we look at how many times you can take the exam, the test is offered 24 times a year, that is twice a month. And one slot is exclusively for nursing and medicine, and the other slot is for all professions.
Right.
And the examination fee would be approximately 32,000. And when we look at the validation of the certificate, the OET certificate is valid for 2 years.
Exactly. Well, now that we have spoken about OET and given you an overview of what OET is about, shall we get into the writing part of it?
Sure. I just can't wait anymore.
Yes. So you see, the writing module, just to recap what we did in the previous session, we spoke about the different types of letters, isn't it? So
yes, we did.
Let's just move on to looking at what the writing module is about. As you already know, it is testing your comprehension and precis writing skills. And here, let me just move on to telling you how you have to go about. So first of all, please understand that whatever is given in your case note, you don't have to write everything. Okay, so there will be distractors in the case notes. You have to be very alert about it. And so as you already know, we have 4 types of letters: referral, transfer, continuity of care, and update. Very briefly put, the referral letter and the transfer letter, they are pretty similar in their organization, and you are required to write almost all the details in both a referral letter and a transfer letter. Let me repeat that. You are supposed to write almost all the details. When I say almost all the details, you're not writing all the details. Okay, you are selecting the content and placing it in your letter according to the structure.
Okay.
Right? So, continuity of care and update. Continuity of care, you have 3 scenarios. One, if you are sending the patient back to a nursing home that they have come from. For example, if Mr. George Smith is the patient and you are in, say, St. Joseph's Hospital, Brisbane, and the patient, Mr. George Smith, has been treated for lung infection, and he was previously a resident of some nursing home in Brisbane. So after the treatment is given, you're going to send the patient, back to that nursing home in Brisbane. Okay, so you would be requesting for continuity of care. That's point number one. Another point that you also have to know is you're sending the patient back to where they came from. That is that nursing facility, right?
Okay. So in that case, you're not mentioning about their past medical history or social background.
Exactly. Yes.
Is that what you wanted to say about?
Yes, yes, that was what. You don't have to talk about the past medical history and the social background in this scenario, as the people in the nursing home already know well about the patient. So the details will be there in the documents, in the related documents. So here you're transferring the patient back to a facility where they are coming from and requesting for continued care and management.
Okay. Well, I think update letter will normally be, you'll be updating the information to the patient's GP.
Yes.
I think the same scenario applies in the update as well, because obviously the patient's GP will know the patient's history.
Exactly.
And the social background.
Yes.
So probably we'll have to write if there are any medications to be continued. Correct. So that will be mentioned in the update letter. Not you're not going to write about anything about the past medical history or the social background.
Exactly. So when there are certain requirements for each paragraph related to each type of letter, it is always better to follow them. You know what? The other thing, the last week we stressed upon the first paragraph, the purpose of the letter. It opens the door for an assessor, for the evaluator to see whether you've understood the case notes thoroughly or not.
Well, it's like the visiting card.
Yes.
Right. So this is all that we have said.
Yes. So this is about all the four letters.
Just we discussed about it. So when we look at the paragraph requirements, the first paragraph, which I did mention it as the card.
Yes.
Yes, which lets you in. It's called the purpose of the letter, where you will be talking about 3 WH questions, where you will mention who is the patient, what is the problem, or what is the condition. If there is any diagnosis as such, you'll be mentioning about it. And meanwhile, you'll be writing why. Why are you writing the letter? So sometimes when there is discharge information, you should never forget to mention about it. The patient is being discharged today, and I think the viewers all know about it, that the discharge date will be the letter date. So instead of writing repetitively the date, you can just mention the patient is being discharged today or tomorrow based on the case note.
Yes. It's really important. And when the date is not given, what do you do when a date is not given? You are going to assume a date.
Yes.
Closer to the timeline which is mentioned in the nursing management. That's one. If no date is given at all in the nursing management timeline, then you're going to assume a date. But please keep in mind that you're not going to write today's date. That day's date.
Okay.
That's important.
And when the discharge date is not given and there are many details with reference to the dates mentioned, then you can choose the latest date that is mentioned in the case note as the date of your letter.
So the second paragraph. What does the second paragraph deal with? The second paragraph deals with the current medical condition of the patient, and which includes when was the patient admitted or presented. You'll have to state that. And as I pointed out the last week as well, important to state the year. Some students tend to miss that, so it's always important to mention the year. So, but it's not mandatory. Let me state it as well. It's not mandatory. So when was the patient admitted or presented? What were the presenting complaints or symptoms? Were they given any treatments then and there during hospitalization or immediately with something? Medications, if any. And patients don't have or don't undergo any complications. If at all there is any, then you will have to state it. You don't have to elaborate on that. You'll one sentence only. And you will be wrapping up your second paragraph with the current status of the patient. How is the patient?
Okay, so the patient is able to mobilize now.
Exactly.
Yes. The patient is stable.
Yes. Yes.
Okay, needs assistance in showering, something like that.
That is what we will be talking about and ending our second paragraph with.
So what happens in paragraph 3? So paragraph 3, you have two options. As I said, in the update letter or when you're transferring the patient back to the care, you will not be writing about the past medical history.
Yes.
In case of a referral letter or when you are transferring your patient to another facility.
Yes.
So you need to talk about their past medical history. And when we say past medical history, please do not include everything that is mentioned. You have to be clever enough in choosing relevant. You have to be clever enough in choosing relevant history that would have some contributions for the present condition.
Yes.
And then you will definitely include some details about the social background of the lifestyle. For example, you may say that the patient is single, divorcee, or widow, married, lives with his wife. And you can talk that works as a truck driver, smokes 25 to 30 cigarettes a day.
Then all this is related to the condition we are talking about and the person we are writing the letter to. So certain social, details, so background details would be added when we are writing to a social worker, right?
Yes.
Yes. And if we are writing to a specialist, then you're going to just consider points that are relevant to the patient's current condition.
Yes. So the fourth paragraph is where you'll be stating your discharge plan or the nursing plan. So you have to be very selective of the points given. And I think most of the points that are expressed here in this would be important. So it might state something that the patient has to be monitored with the blood pressure, or the patient has to undergo an eye test for that matter, or the patient might have some important appointments in the further week or further days. So it might be for the removal of stitches or any further assessment.
Yes.
So without forgetting that you have to mention those points in the discharge plan.
Yes.
And if when you feel that some medications has to be continued, you'll have to mention about that. And without forgetting, if there is something very, very important, you are going to end your fourth paragraph with the mentioning them in the form of off note. You will be reminding them in the off note where you will stress the most important point. Yes. For example, some patients might be allergic to penicillin, or if we are writing to a dietitian, some patient might be allergic to peanuts or lactose. So you should never forget to mention that. So you can write off note, the patient has an allergy to the peanuts, to lactose products. Or as I have already told you, if the patient has an appointment, you can also mention about it. Of note, the patient has an appointment in next 2 days, okay, for the removal of stitches. So you will be mentioning that in off note.
So, moving on to the concluding statements. You will have to conclude your letter, and so after the fourth paragraph, 4 or a maximum of 5 paragraphs, not more than that. So you will be concluding it either with, please do not hesitate to contact me if you require further information regarding, say, please insert the patient's name here, like Mr. Smith or Mrs. John, Mrs. Smith, something like that. Kindly contact me if you require further information regarding. Insert the patient's name. Should you require further information regarding, insert the patient's name and say, comma, please contact me.
So if we have Mr. Smith as our patient, then we can say, please do not hesitate to contact me if you require further information regarding Mr. Smith.
Exactly. Yes.
Kindly contact me if you require further information regarding Mr. Smith.
Right.
Should you require further information regarding Mr. Smith, please contact me.
Yes, that would be perfect.
Signing off. So keep it very crisp, I can say, when you know to whom exactly you're writing the letter to. For example, if your salutation is Dear Dr. Carlson, Dear Dr. Bharat, Dear Dr. something else, when you know their name exactly, when you know the name of the addressee, you will be using yours sincerely. And when your salutation is Dear Sir or Madam, when you're addressing the letter to the designation given. So, Dear Sir, Madam, then you'll be signing off your letter with yours faithfully. Of course, below that, you'll be mentioning your destination, which would be normally a registered nurse or a charge nurse.
Well, we hope you all have understood these points.
I think it was a great brush up session.
So just let us take a minute to look at our dear students who have cleared OET. Very happy to
Yes.
share this about Mansi and also Ritik. So they very dedicated.
Yes.
I think very
They're
dedicated.
already placed in you and they've started their work. We are very happy to see their growth.
Yes. And it's really nice to be a part of their journey as well.
Yes.
Well, Archana and Mary, very, very good students and very kind at hearts. Yes, dedicated, and it's really an achievement, isn't it?
Yes. And if we think that there are some uh, important qualities, probably dedication and consistency
Yes,
is what that matters a lot, which we were able to see in these candidates.
definitely, definitely. All these students are very dear to us, and all our students are very dear to us. And you see, OET, if you want to clear OET in your very first attempt, then consistency plays a key role. And along with that, confidence. You need to have self confidence, not overconfidence, of course, but self confidence. Yes. Is very important to push you forward, and you can clear it in no time.
And I have to say, there are viewers here who might be dreaming of working abroad.
Yes.
And in that case, Charkos will be your best option. Is that what I can say very proudly?
Yes, it is.
So, our details will be displayed in the chats in a few minutes. You can please use the details to contact us at any point of time. And we'll be very happy to be a part of your journey towards your dream.
Yes, I think that's very aptly said. So now, without much ado, let's move on to looking at a case note.
So, what kind of letter are we dealing with today?
Today, I'd like to talk about a transfer letter.
That must be very interesting.
Yes, it is, because there are a few points that I'd like to tell you about. We are sending the patient back to a facility. So what we will do is we will probably start decoding one letter here.
Yes,
for our
I think
viewers.
that would be a great help for them so that it makes them to understand it very easily.
Yes, we will do that. And then all of you, our dear viewers, you will be giving us, you will also keep working on another case note, a case note or two case notes, maybe. They can
Yes,
do that,
yes.
right?
I think in the present case note, they are very sharp enough. I think they can
Yes.
Definitely be a part of drafting a letter out of the case note given.
Yes, so you can, drop in a comment here in the chat.
If you're
box.
ready to start, drop in a message. Are you ready to decode the case note and draft the letter? Let me read out some comments.
Yes, please.
Yes, I'm waiting for the replies. Are you guys ready to decode the case note?
All right. Now, please let us know if you can see the screen.
Is the screen visible? Can you see the case note? Okay. Shall I read the case note for you?
Yes, please.
Yes. Even the viewers are replying, yes, ma'am.
Ready.
Yes, ready.
Thank you so much.
We will not make them wait for a long time. Yes, let us begin with reading the case note. And keep in mind, I hope you're all aware that you will have exclusively 5 minutes allotted to read the case note. But I would say it is okay to take 1 or 2 more minutes extra. But everything that is in black and white has to be read. Everything that is mentioned has its importance. So don't left anything unread. So it is the first key to decode the case note. So when we look at this case note, it says Mr. Gerald Baker is a 79-year-old patient on the ward of a hospital in which you are a charge nurse. The patient details goes like this: marital status, widower, 8 years, since 8 years. And admission date is 3rd September 2019. Discharge date is 7th September 2019. And the reason for admission, that is on 4th September 2019, left total hip replacement. It was an elective surgery. And worsening arthritis, difficulty mobilizing and climbing stairs. Social background: has lived at Grey Walls Nursing Home for 4 years. No children. Employed as a radio engineer until retirement, aged 65. And the details of the hobbies include chess, ham radio operator. Sister Dawn Mason, who is 66, visits regularly and very supportive. No signs of dementia observed. Medical background: so in the year 2016, osteoarthritis requiring total hip replacement surgery. 1989, hypertension, ongoing management. So 1985, Collis fracture, ORIF. Medications: Ramipril 5 mg, Panadin 40, paracetamol 500 mg or codeine 30 mg. And nursing management and progress says daily nursing dressings, surgery incision site, range of motion, stretching and strengthening exercises, occupational therapy, staples to be removed in 2 weeks. That is on 21st September. Right. Follow up, FBE and UEC tests at City Hospital Clinic. And assessment: good mobility post-operation, weight bearing with use of wheelie walker, walks length of ward without difficulty, post-operative disorientation, read time, and place during recovery, possibly related to anesthetic, continued observation recommended. Dropped HB post-operatively to 70 gram and requiring transfusion of 3 units packed red blood cells. And now HB is stable on discharge. Ongoing monitoring required for anemia. And the discharge plan says monitor medications, Panadin 40, preserve skin integrity, continue exercise program, equipment required, wheelie walker, wedge pillow, toilet tracer, hospital to provide walker and pillow, hospital social worker organized 2-week hire a phraser from local medical supplier.
Right.
And the writing task says, using the information in the case notes, write a letter to Miss Samantha Brui, senior nurse at Grey Walls Nursing Home, 27 Station Road, Grey Walls, who will be responsible for Mr. Baker's continued care at the nursing home.
Right. So thank you so much for reading this out. Let us, we will be displaying the screen so that you will be able to take a screenshot of it. Okay, so you can first take the screenshot of the writing task. Please make a note of it. Points are important. Make sure you're taking a screenshot of this writing task. Assuming that you have, let me move to the top of the case note. I'll go to the top of the case note so that you can take a screenshot of the details, the patient details. Yes, now we have the social background. Next, the medical background with the medications. We have another medication in this page. Next, nursing management and progress, along with your assessment. Okay, next is the assessment. And now comes the discharge plan. Right, all right. So, shall we start decoding? Yes, all right. So, you see, when you look at the writing task, it says, write a letter to Miss Samantha Bruin, senior nurse at Grey Walls Nursing Home, 27 Station Road, Grey Walls, who will be responsible for Mr. Baker's continued care at the nursing home. So the key points that we are going to mark here would be the addressee's name, because we have to fill up the addressee block. So Miss Samantha Bruin, senior nurse, from there till Grey Walls, let me highlight that. Yes. And also, dear viewers, please let us know if you're able to see the screen clearly and whether it is visible, the font is visible. All right. So I think there is a connection here, which we should never ignore. When we see the very beginning of the case note, it does say that he is staying at Grey Walls. Yes. Yes. So the same thing. So that gives us a hint that the patient is being transferred to the place where he is. Yes, come from. Exactly. So she will be the lady here, Miss Samantha Bruin, will be responsible for Mr. Baker's continued care at the nursing home. Let me just highlight this preposition as well, at. Yes. Yes. Let us ask the viewers, what is the difference between at the facility and from the facility? Yes. I'm repeating it. Please use the chat box to share your answers. Let us know what is the difference between at your facility and from your facility. We have typed it here on screen. You can please start typing. We will read out your answers. At and from. Typed on screen. So yes, we'll come to waiting for your replies.
difference between at your facility and from your facility.
You can also tell us, ma'am, there's no difference at all.
Yeah.
So we are going to just say continued care at the nursing home or continued care from the nursing home. Anything can be your answer. But just make sure you're letting us know your thoughts in the chat box.
So that makes the session very interactive.
It does. Yes. We do have one person, I think it is Ginny, who's telling us that at your facility, at in the facility. Correct, Ginny. That's correct. So when the patient is going to stay in a facility and be taken care of, that would be at the facility. Whereas from the facility is wherein, for example, the patient is Mr. Smith and Mr. Smith is going back home. And you, as a nurse, are writing to a specialist concerned, probably maybe the
Physiotherapy.
yeah, you're a physiotherapist. So you're requesting visits to Mr. Smith's house from the physiotherapist. Then you're telling them they would be requiring continued care and management from your facility because the specialist belongs to a particular center and therefore you're using from your facility.
Shalom has answered. At means he will be staying at the home.
Yes. At the home, in the sense, let us clear this confusion for you. Not at his own home, but if you mean at the nursing home, then you've done a good job, Shaz. Yes. Thank you. Let's quickly move to the top of our case notes. So you see, Mr. Gerald Baker, 79-year-old patient on the ward of a hospital in which you are a charge nurse. 3 things to be noted. One would be the personal details. Gerald Baker, 79-year-old patient. And
you are a charge
nurse. Charge nurse, this will help us when we are signing off the letter. Widower, admission date, discharge date. So the discharge date is given as 7th September 2019 because this is the latest entry and discharge date is there. We are going to make it the date of our letter.
Yes. So 7th September 2019 will be the date of your letter.
Date of your letter.
Known case, the one who is taking know the person already. At means the nurse doesn't know about the patient. Well, I think you have given that clarity.
Yes.
So when you are in a simple word, if I have to say, if you are sending patient to the facility and the patient will be staying in the facility, then you will use at the facility. And when you're sending patient back home and you want people from the facility to go there and assist, then it will be from your facility.
That is the only difference and very simple one at that. Next, we have the social background, which we are not going to look at right away because we now have to frame our purpose. The thing is, the reason for admission says left total hip replacement, which was an elective surgery due to worsening osteoarthritis, which was making it difficult for the patient to mobilize and also climb stairs. So in this case, we have to understand that whether after the surgery, the patient is recovering well or not. Mm-hmm. So this will also help us frame our purpose.
Okay.
All right. So looking at the nursing management and progress, it says daily dressings at the surgery or the incision site, range of motions, stretching, strengthening exercises, occupational therapy given, staples to be removed, which is for the next round. And the assessment says post-operatively,
good mobility post-operation. There is some improvement.
Yes, there is. And weight bearing with use of wheelie walker works length of ward without difficulty. Right? So post-operative disorientation regarding time and place during recovery, possibly related to anesthetics, continued observation recommended, which means that there was some sort of a confusion and disorientation in the patient regarding the time and place during recovery. But apart from that, we don't have any other problems. right? So the patient seems to be doing well after surgery, right? Okay. So in this case, I think we can start framing our letter.
Yes. So we have already known that. What is the letter of the date?
It is 7th
September 2019.
7th September 2019. Yes, 2019. Now leave a line space. Then comes the addressee block.
Yes.
So to whom are we writing to? We are writing to Miss Samantha Bruin. So please keep in mind that you're not supposed to use abbreviations. It is supposed to be MISS. So MS to be expanded to MISS. So Miss Samantha
Bruin.
And what is the designation?
Senior nurse.
Senior nurse.
And that's it.
Yes.
And Grey Walls Nursing Home.
Nursing home.
27 Station Road.
27
Station Road.
Okay. Station Road. Is that all?
Grey Walls.
Grey Wall. Okay. Thank you. Well, you see, we haven't made use of any punctuation mark in this addressee block, and you should not as well. Make sure that the address lines are one below the other without any space in the lines, between the lines. So first you're writing the date in this format, then you're leaving a line space and then adding the addressee's details. After this, leave a line space again, and then comes the salutation.
Dear Miss Bruin. And don't forget to put a comma.
Yes. Oh, I'm sorry with the mistake. Spelling mistake. Miss Bruin and a comma. If you look at our previous video, you will understand that we have explained this part in detail, why it is Miss Bruin, dear Miss Bruin, and not dear Miss Samantha Bruin.
Yes.
Please check out the previous video for more details on this. After the salutation, we leave a line space again and write
regarding,
yes.
Mr. Gerald Baker.
Baker, is it?
Yeah. And then age is 79 years old.
79 years?
Yes.
All right. So this is done. I think you are all able to see the screen. You can take a screenshot of it if you want. So from the date to the date of birth, this is the format that you will be using.
And I think we'll give some time for the viewers to think about how to frame the purpose of the letter.
Yes. So you can, now that you have, if you finished writing down from the day to the date of birth, guys, please in the comments box tell us what will go in our first paragraph.
How will you start the letter?
Exactly. One hint would be keep the 3 WH questions in mind and frame your first paragraph. You can quickly start typing here in the chat box.
And there is 4th WH as well. The discharge date is mentioned.
Yes.
Please start typing your purpose of the letter in the chat box. We are waiting for your replies.
So we really hope that these sessions are useful and you're able to frame, and don't miss to watch out for our live classes every Wednesday at 2 p.m. IST.
Yes, we have got a question here from George. Hello, ma'am. Why is punctuation not used after Mr., Miss, or Mrs.? I think Mr. George has missed our previous session.
Yes, he has. He probably has. But let me just tell you, this is the norm when we are writing. So let me just quickly explain to you why we don't use it. Because, see, Mr. MR is the abbreviation for MISTER, right? And the next one is doctor. for example. All right.
BOCTOR.
BOCTOR. But there is another doctor that I will talk about. Doctor, then here. I'm just going to place a full stop, then a hyphen. This would be
Doctor of Philosophy.
Yes. Doctorate. Shall I cut it?
Yes, you can.
So this is the doctorate. All right. And also, Miss is one. MISS. Okay. Now, all of you should know this. You see, the first letter. Okay. Let me highlight it.
And the last letter.
The first letter and the last letter is taken to come up with the abbreviation. That is Mr. So this one is the same and the last letter is the same. So you don't have anything after that. If it was probably, if T was taken instead of an R, then you would place a full stop.
Okay.
Now you see here in doctor also. So in this case, let me just put it in the bracket as a doctor of medicine. Any other area of specialization. In this case also, the first letter of this abbreviation and the last letter that is used in this abbreviation is the same. Okay, so it does not change. But what happens to a doctorate?
Doctor of Philosophy.
Doctor of Philosophy. If they have a PhD, then we are going to place a period after this abbreviation. And why so? You see, the first letter here is D. And the last letter in doctorate is an E. But you don't have an E at the end of doctor here. So that is the reason you're going to place a period.
All right.
Okay. So I'll change the color of this so that the viewers also know that there is a difference. Right?
Yes.
So if the person you're talking to or you know somebody who has done their doctorate, then you'll be placing a period after the abbreviation and then continue the name. And the same rule.
So in that case, it is Dr. Dr. Anusha Bharat.
Yes. Yes, you have to place a dot after my name. But if it is a specialist from the field of medicine,
yes,
then if from the medical field, then no, you're not going to place a full stop there or a period.
So if it's a Dr. Manikimpal, then you have to say Dr. space Manikimpal.
Yes, that's right. So Miss also, the same thing. The first letter of the word and the last letter of the word combine to make the abbreviation. And that's why we don't place a full stop. We hope we have answered this question of yours.
George, I hope we have cleared your doubt. Well, by the time we have got so many replies, well, we are very happy to witness such energetic, enthusiastic viewers today.
Really nice. Really nice.
So Miss Colley has written, I'm writing to refer. My dear, it is clearly told that we are transferring the patient here to the care. So I'm writing to transfer would be apt.
Yes.
A small correction. And Sharon has replied, I'm writing to refer Mr. Baker. So it should be I'm writing to transfer Mr. Baker, as it is a transfer letter. Yes. If it were the referral letter, then this would be apt.
Yes.
But we have clearly explained the patient has undergone a hip replacement surgery and the patient is being sent back to the facility where he came from.
Yes.
So you're transferring patient back to their care.
Exactly.
So it is, I'm writing to transfer Mr. Baker.
Yes.
So this is to transfer Baker and the purpose of it continuing care at nursing home.
Yes. I think I'll delete this part of it. Okay.
Yes.
So yes, from the date to the date of birth, we have the details. And now let us start writing. As ma'am said, you can also say transfer. If at all you have a doubt, then the word that you can use would be regarding. Yes. So
I'm writing regarding Mr. Baker.
All right.
So you answered first WH here. Who is the patient? Mr. Baker is the patient.
Yes. Do we place a comma or not?
Yes, we have to. Because we are separating the patient's name and we are going to mention about the condition here.
Right.
A total replacement surgery. So keep in mind, when you are talking about the condition, mentioning about the condition, so you will, a disease condition for that matter, you will use the article here. I think we'll have to tell a little about the article.
Yes.
Usage of articles here. Why is it a total hip replacement surgery? So before the condition, that is very important. And when you use the article, be very sure of one thing. It is not just the letter, but it is the phonics, the sound that is going to help you in deciding what article is to be placed over there.
Exactly. I think we can run a session.
Yes.
Then on usage of articles and how to use the importance of articles, because all the Indian languages do not have articles.
Yes.
All the Indian languages don't have that. So when we are using it, because English is a foreign language, of course. So where do we use it? When do we use it? And how do we use it? So we will be answering these questions for you very soon in one of our live sessions. You can look out for that as well. So here we have said I'm writing regarding Mr. Baker, who has undergone a total
hip replacement surgery.
I'm taking a full stop here so that the sentences don't get clogged.
Yes.
Now, when we looked at the writing task, we did mark continued care at the nursing home, right? And this patient, if you saw the discharge plan and the assessment as well, it says will be, I think it was here that I saw it, or that the patient is going back to the facility
Yes.
that they come from. So it would be better for us to say that he requires, let us answer one
Yes.
WH question. He requires
Continued care
and
management at your facility.
Yes, at your
Facility.
and
he is being discharged today.
That can also be said.
Can we also include that in the previous sentence? Can we write it like as I'm writing regarding Mr. Baker, who has undergone a total hip replacement surgery and is being discharged today?
Okay.
Is that?
You can also say that, but one factor, where do I add he's being transferred back to your facility? So shall we say replacement surgery? Shall we just change this line then? This is one option. This is option number one. Okay, let me just mark it as option one. All right. And
the second option,
highlight it as well so that you guys don't get confused. That's one.
This is also right. We are giving another option.
Yes.
Option two.
Option two would be
I am writing to transfer
Mr.
Baker
back to your
facility.
Back to your facility. Back to your facility. Full stop.
He has undergone a total hip replacement surgery. And requires continued care and management.
All right. Management. We hope this is clear for all of you. Let me just change the color. See, these two are options that you can use to frame your first paragraph. So once you have completed your first paragraph, understand that you'd have to recheck your purpose, right? So when you're rechecking your purpose, make sure to check whether you've answered those 3 WH questions in brief, not in detail. You're not supposed to, you're not going to tell me how Mr. Baker, had the mobility issues or this or that. All right, you're just going to tell me that he's undergone a total hip replacement. That's it.
I have another option too.
Yes.
To say language is such a beautiful blessings, I have to say. So we have many options.
Yes.
So we can even write, I am writing regarding Mr. Baker, who is being transferred back to your facility. And we can mention he has undergone a total replacement surgery. And he requires continued care and management.
All right. Shall I write that also?
Then you might have, we get n number of options. I think we'll not confuse them.
All right. So this is.
We'll retain the first one
and
option 1.
Option 2. Right.
So when you start loving the language, you can start playing with the words.
Yes.
So dear viewers, what is that one thing that we would say to that? It is always very important to learn and keep learning the language.
Yes.
So as you learn, you will be more confident.
Yes.
What do you say? So please
Definitely.
try inculcating some reading habits. So it's very, very important to have that as a part of our life.
Yes, it is. So, well, moving on to the second paragraph. Here we have
current medical condition.
Right.
Obviously, we have told that in the beginning introduction that
yes,
the second paragraph would be your current medical condition, where you will be writing about the admission. You will start the paragraph with the admission details. So in this case, you can say Mr. Baker was admitted on, I hope it's 3rd September, if I'm not wrong.
Yes, let's. 3rd September
2019. And the reason for the admission was the total hip replacement surgery and worsening osteoarthritis. And then what we have to see. So we'll have to consider this paragraph.
Yes. Aspirin 100 mg was which was recommended post-operatively. And also, is there any other detail that?
Yes, I was about to say.
Okay.
And then so yes, attained a good. There are few complications here.
Yes.
So you did mention about it in the slides. So when there are complications, the complication in this case is that the HP level had drastically come down.
Exactly.
So you have to write about that.
So this is one thing that I'll be highlighting here.
Yes.
HP post-operatively, which required a transfusion of 3 units of packed red blood cells. So, all right. On discharge, the HP is now stable, but he requires ongoing monitoring for anemia, which we will put it on our fourth
Was he commenced on?
Well, he was commenced on Panadyne Forte and aspirin 100 mg post-operatively, but that did not continue, right?
Yes, that did not continue. So
we will actually state it as a single sentence.
Yes,
in our second paragraph.
And I did see somewhere about that exercises.
Yes, here range of motion,
stretching,
and strengthening.
This was the part of your management.
How you manage the patient, how effective your management was. It comes under nursing management or regular management of the patient, basically what you did and how you helped the patient recover or cope with a certain situation. That all is placed in the nursing management, and looking at that, you will be answering or organizing your second paragraph.
So shall we continue typing?
Yes, please. So the first paragraph,
Mr.
Second paragraph was admitted on 3rd September 2019.
So have a look here. Whenever you write the name of month or days. So you will use the uppercase. September 2019.
2019, a
Mhm.
comma.
Mhm.
Well, for the above mentioned procedure, because that
It's already stated in the purpose.
Yes.
So avoid repetition for the
above mentioned procedure.
Is above mentioned an hyphenated word?
Definitely.
Above mentioned procedure. Shall I use the full stop?
Yes, please. A period there.
Yes.
And then what happened post-operatively, as we've already seen in the case notes, the gentleman has attained pretty good recovery.
And he was able to move as well.
Definitely, yes.
So,
that's correct. So let's just say that post-operatively,
okay.
Post-operatively, comma, post-operatively, comma, he attained good recovery.
I'll have to. I forgot the mention.
Yes.
Here.
Post-operatively, he
attained a good recovery.
Right. And then what did you observe? His HP level dropped.
Yes.
Right. So let's take that and say, however, can you use that word there?
Yes.
We'll use a reasoning word, a word which denotes it. However, comma.
However,
his HP level dropped. His HP level dropped.
His HP
level dropped. Comma, for which? Yeah. He was. For which he was. Subsequently. For which he was subsequently. Transfused. With 3 units of. Packed red blood cells. 3 units of packed red blood cells. All right.
Okay.
Yes, that's done. And now that we've said what complication he had, it would be proper for us to tell the person we are writing the letter to how the patient is right now. Currently, the current status of the patient. So let's say if you want here, you can also add the medication, and you can say that his current medication includes. See, there are 2 options. You can either write it here, or you can state it in the 4th paragraph as well. No worries. But we are just placing it here. If you want us to, shall we place it here or shall we push it?
I think we'll push it to the 4th paragraph.
All right.
What do you say?
Yeah, that's
so we can write. I think we can write about that stretching exercises here.
Yeah, we are going to now talk about. And he has been commenced on
various
stretching and strengthening exercises.
Various.
Yes.
Am I right? Stretching, right? Sorry.
Yeah.
Stretching and
strengthening exercises. Strengthening exercises.
Shall I place a full stop here?
Yes, please. All right. And 1 second. Let me move to the top. All right. Now that we have, completed this part, the second part is done with the current status of the patient.
Mhm.
Now, because this is a transfer letter, what goes in our third paragraph? We want our yes, please state in the comment in the chat box what would go in the third paragraph according to the paragraph requirement that was discussed. Yes. Is it option 1 or option 2?
You are transferring the patient back to their care.
Yes, they're going back to the facility where they have come from. So let us know in the chat box.
What is the requirement of the third paragraph?
Yes. And it's interesting to see how many viewers here have understood what is happening with the case note, and they seem to be following really well with all of this. And we are glad to have all of you with us today. And please make sure to subscribe for more such content related videos. You will be notified of it.
Yes. Your feedback and suggestions are welcome too.
Yes, so definitely.
Helps us to improve.
Yes, sure.
Waiting for your replies. Please start typing. So, what should be mentioned in the third paragraph?
Yes. Is it option 1 or option 2? Well, Santosh here says option 2. Okay.
Smart.
Yes. Well, thank you, Santosh. Yes, it is option 2, wherein we are not going to talk about the social background or the lifestyle background of the patient. Instead, we are going to concentrate on the current medications and the dosage that has been prescribed.
Yes. Shall I start typing?
Yes, please. Mr. Bakers. Leave a line space after each paragraph. Mr. Baker's current medication. Mr. Baker's current medication includes
the medications.
Medications include, he has Ramipril aspirin, right? Yes. So includes aspirin.
Should I place any punctuation mark here?
Well, not necessarily. So includes, current medications include aspirin, 100 mg, Ramipril, 5 mg, and Panadine Forte. I don't think they have given, the dosage for Panadine.
They've just mentioned
Panadine Forte. All right. So that should do. And this was actually, the R here was an autocorrection. Well, let us tell you that if you have written the first medication, that is, if this is in, say, it starts with an uppercase A, if you have written it that way, then all your medications
should be in
uppercase. So A, R, and
P. Yes.
P and F. P and F. Yes, because we did not do that, then we just left it with in the lowercase. So
if you start with uppercase, you have to rename that in all the name of the medicines. If not,
it's going to be in the lowercase. That's not an issue at all. So,
Forte, should I place a full stop here? Is this the end of the sentence?
Yes, please. Panadine Forte. Now, moving on to the fourth paragraph, which will discuss about the discharge plan. So, The fourth paragraph will now talk about
the discharge plan.
Yes, the discharge plan. Let us quickly look at the discharge plan. Look at a few points here. It says monitor medications, paradigm footed, preserve skin integrity, continue exercise program. Equipment required is wheelie, walker, wedge pillow, toilet freezer. Hospital to provide walker and pillow. Hospital social worker organize 2-week hire of freezer from local medical supplier. So we are going to put these as well. And there were a few things that were mentioned in the nursing management and process regarding staple removal in 2 weeks and follow-up tests at city hospital clinic. Let me mark this in blue. Make sure that you're adding these as well, because this is not the current status. It is going to be on the 21st of September. So moving on to the fourth paragraph. Shall we start?
Yes, please.
So we usually begin with it would be appreciated or it would be beneficial, anything of this kind. Or you can directly start by saying kindly monitor or please monitor.
So again, you have three options here. It would be appreciated, it would be beneficial, kindly.
Yes. So we can start by
what do you want me to?
Let us see, so that they know, we will start off with it would be appreciated. You can make these changes. It would be appreciated. It would be appreciated if you could monitor. If you could monitor. It's tagged twice. Sorry. Yes, if you could monitor
Mr. Baker's medication, am I right?
Yes, Mr. Baker's medication compliance. Mr. Baker's medication compliance. Medication compliance. Sorry. So, medication compliance. Medication compliance.
I think they have specifically told about Panadine 14.
Yes, about Panadine because it's in the bracket. It's given in the bracket. So medication compliance.
Particularly?
Yes, particularly Panadine 14. Right. And then it talks about skin integrity maintaining.
Yes.
So we can say that it is important. It is also important to maintain his skin integrity. So it is also important to maintain his skin integrity around the surgical site. And dear viewers, you can also drop in whether this will have an off note or not. You can let us know if this particular letter will have an off note or not. If yes, then what would be the off note? You can quickly type it in the chat box.
Do we have something to mention in the off note? If yes, what is that we are going to mention?
Yes. Well, we are
waiting for your slides.
Yes. So before we get to the off note, can we just mention a few more details here?
Sure.
About the requirement of wheelie walker?
Yes.
So we can say regarding his required equipment, regarding his required equipment. Got it.
Oh, I'm missing.
That happens. It happens with the keyboard. No problem.
Typo.
Yes. Regarding his required equipment, the hospital. The hospital will provide a wheelie walker, and a wheelie walker and a wedge and wedge below and wedge below, comma, and a social worker and a social worker
or social worker.
yes. And a social worker. I think we'll have to place a comma after below. We'll provide a wheelie walker and wedge below, comma.
And I forgot to place an hyphen here.
These hyphenated words can be a little confusing, but with all of you will be able to do it easily once you start writing the case notes and once you're familiarized with the words. Not to worry at all. And social worker will be or will source a toilet razor from a local supplier for a 2-week hire. Week. Yeah. We'll stop. Now waiting for your response.
Yes.
Coming to this.
Off note.
Yes. So the off note
is the removal of the steps.
Yes. So we have one would be, you see, we have marked it in blue as we told you in the beginning while looking at the paragraph requirements also. Staples to be removed in 2 weeks, which is given as 21st September. And the other is follow FPE and UAC tests at City Hospital Clinic, right? So we are going to place that in the off note. Okay. So off note, comma. His stitches are to be removed. His stitches stitches are to be removed. Stitches are to be removed on
21st.
On 21st September 2019. On 21st September 2019. 21st September 2019. And
Sure.
yes, please. And he will have to undergo. He will have to undergo, follow up, undergo, follow up. Follow
Just
yes, please. Follow up. Follow up. FBE, and UEC tests at City Hospital Clinic. At City Hospital Clinic. All right. Yes, I think we've covered almost all the points here.
yes.
Right. Now we'll be concluding this letter with the statement. If you have further queries regarding
Yes.
Mr. Baker, if you have further queries, regarding queries regarding Mr. Baker, comma, please contact Please contact. Please contact. So make sure that please contact. So all of you, please make sure that you are stating the patient's name in this and also in the concluding statement. That's one. Secondly, don't forget to mention the patient's name at least once in each paragraph. You can just use the name once and then continue with the pronoun.
So signing off.
Right. Yours sincerely, because
we know the addressing.
Yes. And the addressee here for today's letter is Miss Samantha Bruin. So yours sincerely,
You are charged nurse.
Yep. So this is our letter. You can take a screenshot of this. We are going to move to the top of the letter first. From the date to the date of birth, please take a screenshot for your reference. You can use this as a sample letter, and based on this, you can, work on other case notes which are similar. But nothing changes from the date to the date of birth. The
Yes.
Remains the same. Please do take a screenshot of this. And we hope you've understood why the third paragraph only has the current medications and dosage and not the social background and lifestyle. For more details regarding this, you can, watch our previous session. This is the fourth and the conclusion. Right. So, so we do actually have a task for you all.
Yes.
Shall we tell them about it?
Yes. The task is very simple. I don't think we will be asking them about drafting a letter. Please don't think so.
No.
We will be displaying or sharing the case note. We just want you to frame the first paragraph. That is the purpose of the letter.
Yes, exactly. So you can take a screenshot of it as we read. See, this is your task and an assignment,
Yes.
Yes. The task 2 says Mr. Lionel Ramamurthy, a 63-year-old, is a patient in the medical ward of which you are a charge nurse. Hospital, Newtown Public Hospital, 41 Main Street, Newtown. Details: Lionel Ramamurthy, widowed, spouse deceased 6 months ago, community retirement home, Newtown. That is where the gentleman resides. Next of kin, Jake, son, 37, married with 3 children under 10. Sean, 30, married with 1 infant and is working overseas. Admission date is given as 4th February 2019. Discharge date as 11th February 2019. Diagnosis is pneumonia. All right. The past medical history talks about osteoarthritis, mainly fingers, for which he's on Voltaren, a diclofenac. Eyesight decreasing due to cataracts, removed 6 months ago, which needs checkup. In 2007, he was diagnosed with type 2 diabetes, which is now controlled by diet. Good for the gentleman. 2018, chronic obstructive pulmonary disease, COPD, was diagnosed back in 2018, right? And the current medical condition?
Admitted with pneumonia, acute shortness of breath, inspiratory and expiratory wheezing, persistent cough, chest and abdominal pain, fever, rigors, sleeplessness, general aches. On admission, mobilizing with pickup frame, needing assistance with showering, dressing, etc. Very weak, ambulating only short distances with increasing shortness of breath on exertion. And the medical progress says a febrile inflammatory markers back to normal, slow but independent walk and shower or toilet, dry cough, some chest and abdominal pain, weight gain is about 1.5 kg.
Social background states that he's a retired school teacher who's financially independent and has been lonely since his wife passed away, as we saw 6 months ago. Weight loss of approximately 4 kgs in 6 months, which is associated with his poor diet. Nursing management, how did you manage the patient? Encouraged him on?
Oral fluids, proper nutrition.
Right.
And ambulate as per physio.
Right.
Encourage chest physio, where it included deep breathing and coughing exercises. Sitting preferred to lying down to ensure postural drainage.
Okay.
Discharge plan includes paracetamol, if necessary, for chest or abdominal pain. Keep warm. Good nutrition, where you have to increase fluids, eggs, fruit and vegetables. Needs help monitoring his diet.
Right. So the writing task says that using the information given in the case notes, write a discharge letter to Ms. Georgine Ponsford, resident community nurse at the Community Retirement Home, 103 Light Street, Newtown. This letter will accompany Mr. Ramamurthy back to the retirement home upon his discharge tomorrow. So we are writing a letter. Please don't get confused with these words, discharge letter. So, ma'am, what does discharge letter mean? You just told us about referral, transfer, continuity of care, and update. And where did this discharge letter come from? Well, you are talking about the patient. The patient will get discharged from the hospital. You don't have to worry. Just understand what type of a letter this is. You're writing to the resident community nurse at Newtown, and the gentleman has also been a part of the same retirement home.
So again, it is a transferring the patient back to their care.
Yes. Perfect. That would be perfect. So you are requesting for?
So I've already given them a hint now.
Exactly.
So I was not supposed to tell them.
But I think that's really nice, very sweet of you to have given them a hint. We will be awaiting for your response. You can drop in your purpose, you can write it, and you can share it with us here in the chat box.
Waiting for your replies. Yes. Curious to know whether you have understood.
Yes.
Keep typing the purpose of this letter, the purpose of this case note.
So
use the chat box to share us the purpose of this case note. Why are you writing them? Just the first paragraph. And I've already given you a hint that it's a transfer letter.
Yes, it is a transfer letter.
Spoiler.
Yes, spoiler alert ahead. She's already
a transfer letter.
Yeah, a transfer letter, and she's also given you a few hints with regard to the keywords as well.
Yes.
Make sure to use it to the fullest.
So Ms. Monica has said this is a very fruitful practice session. Thank you, Monica Rai has mentioned that it is an excellent program. Thank you.
Thank you, everyone, for your constant support. And we look forward to your active participation as well in these sessions every week. Please mark your calendars. We are going to be there on your screen every week, every Wednesdays at
2 p.m.
2 p.m. IST.
So the details of the classes have been mentioned there in the chat box. The contact numbers are being displayed over there. You can please use the contact numbers to contact us, where we'll be providing comprehensive training for all the professionals for a better career. We are here to assist you.
Yes, always. We'd love to be a part of your journey. And Charkos will be there every step of the way.
Yes.
Be it OET, be it CBT, OSCE, your recruitment.
It's a one-stop solution.
Exactly.
To make your dream come true. Well, so regarding the purpose, you can, so shall I say the answer? So you can say, this is to transfer Mr. Ramamurthy,
yes,
back into your care. And
I think we can type it for them. Just another spoiler for them.
No, diagnosis is pneumonia.
Yeah.
So he's recovering from pneumonia and requires continued care and care and management at your establishment.
Yes.
And obviously, there is discharge information here.
Yes, the discharge date is given as
he is
February 2019.
So you will be mentioning about the discharge as well there.
So because you've already stated the discharge date on the top of your letter, here you're going to say, and will be discharged today.
Yes.
That's all it is going to be. It's as simple as that, guys. Please make sure to understand how this works. You can look at our videos and you will definitely be able to decode each and every paragraph easily.
Yes. Join us for more benefits.
Yes.
And stay tuned for more updates regarding the YouTube live classes. Please join the community for the latest updates. And it is us signing off from this session. See you in the next session. Dr. Anusha?
Yes, and this is Nagashri. See you
again in the next session.